I'm going to quickly go over interview question styles. There's quite a lot to go through, so I'm sorry in advance if you feel a little bit overwhelmed, but we will be uploading the slides on our website, so don't worry too much. Um, so the first style I want to go over is the most common question that people usually think about when they think about interviews. So motivation and personal insight. So you might get asked a question about what is your motivation to go to become a doctor, and what do you understand about being a doctor? So the what when they ask these questions, the thing that they're looking for is why you want to go into this career and assessing whether you have the qualities of a future doctor. And some of the questions that you can think about would be, why do you want to be a doctor and why not any other profession? So a lot of the times people will say, why do you want to be a doctor? Well, I want to help people. But that's an example of a weak answer, just because of the fact that there are so many careers out there where you can help people, whether that's a lawyer, a teacher. So you need to be specific. Why specifically a doctor? And you also have to have an understanding of why a doctor and not any of the other allied healthcare professionals. So why not a nurse? Why not occupational therapist? Why not a physiotherapist? Why specifically a doctor? Um, so another example is, what are your strengths and weaknesses and how do you handle stress? Where do you see yourself in 10 years? And also a really important one, why this specific medical school? So take a look at the demographic area of the hospitals of the medical school. Maybe you're really interested in certain societies that they offer. Um, and maybe you like the way that they teach anatomy. Maybe you like the way that they teach medicine as a whole. So make sure you do a little bit of reading about this beforehand. I know that in the Brighton and Sussex interview I had, they asked something very similar about why specifically this area, and to have the knowledge of the fact that in that area they have a lot of young adult population, they have a lot of LGBTQ population, and so understanding these kind of demographics is really important and shows that you are really taking an interest into them in their medical school. So I'm not going to read through all of this, but what some of the things that they're looking for are conscientiousness, teamwork, academic ability, honesty, and all of these kind of personality traits they're looking for when you answer your questions. It's really important that you reflect on your experiences. So this might not just be your GP placements, it could literally be anything. So it could be the fact that you volunteer at a charity shop, or when you played in a football team and you had a match. So keep a record of everything that you've done, write the time, date, and place that you've done it, and keep all your certificates and some proof. So this is an example of the Gibbs reflective cycle. So write down what happened, what did you feel, what was good about the experience and what was bad, analyze that situation, come to a conclusion, and action plan. If the same thing happens again, what would you do the same? What would you do differently? Um, the other question is medical ethics. And this is also another popular question style. And this is to test reasoning, empathy, and judgment. So an example of a question would be, a patient is diagnosed with HIV. Patient diagnosed with HIV reveals to their GP that they have not disclosed this information to their partner, discuss the ethical issues involved. So something that's really important is you need to take note of what exactly they want you to do. So they want you to discuss. So this would mean talk about the different aspects about what you would do during this situation, what are the problems that could arise, and kind of go over everything, not just, okay, this is what I would do. You need to go through all the different options and come to the best option. So a little bit about HIV. So you might have done this in A levels, but I think it's good to have a certain level of understanding about important pathologies or important diseases. And a lot of the older population will know that HIV was a massive topic as well. And HIV is a virus that attacks the immune system by destroying CD4 cells, so white blood cells, leading to AIDS over time if left untreated. And it spreads through specific bodily fluids, but not by casual contact. And this is a treatable disease with antiretroviral drugs. And this allows people with HIV to live long, healthy lives. And this is an example of a public health campaign that they did. So it says U equals U, which is undetectable equals untransmissible. So this was a really big public health campaign that they did to reduce the stigma around HIV. Yeah, so when you want to answer these kind of ethical questions, you can use the pillars of medical ethics. So this would be autonomy, beneficence, non-maleficence, and justice. So autonomy is how do you make sure that the patient can decide what they want to see in their treatment? Beneficence would be to do good for the patient and act in their best interests. Non-maleficence would be to make sure that you're not doing harm to the patient, and justice would be to make sure that your actions are equitable and you're treating all your patients fairly. And another concept that I think is really good is dignity and honesty. So when we answer that question, you want to note that autonomy would be doctors must respect the decision made by a patient. So the decision that the patient made was to not tell their partner, but patient's autonomy is not absolute, particularly in a case like this where society or another patient is at risk. And in this case, confidentiality, so making sure that you don't disclose that patient information, it can be broken, but this may affect the doctor-patient relationship, and that's something that you need to highlight in your answer. And when we're talking about to do good and to do no harm, doctors must continue to provide the best care in the patient's best interests. And when making a disclosure, it's important to weigh up the benefits, so protecting another patient's health against harm affecting the doctor-patient relationship and future disclosures. So the patient might not tell you things in the future which could affect them and their treatment in the future as well. So it can also be a good point to mention that you might want to consult the GMC guidelines, so good medical practice guidelines, or you might want to speak to someone senior about this, so the consultant or the practice manager. So by showing in your answer that you can weigh up all of these options and come to an answer will show them that you are a strong candidate and that you know the implications and the complexities of being a doctor. So here's some key concepts. You would have noticed that there's a lot of keywords, so I won't go through it specifically, but sometimes it can be good to have these keywords in your answers. So for example, Gillick competence or duty of candor. Another style of question is role play stations. So it's kind of what it says on the tin, but essentially you'll get a stem, you'll get a question, and there will be an actor which will be going through the scenario with you, and then you'll have an interviewer marking your answers and marking the way that you interact with the actor. So for example, an example of this is, while your neighbor was away on holiday, you're responsible for looking after their pet. Unfortunately, the pet went missing after you accidentally left the front door open, and explain the situation to your friend. So the questions are not always medically related. So for example, this was a pet. And this is, so when you get this kind of question, you want to think about what actually do they want to see from me? They want to see that you're empathetic. They want to see that you care. They want to see that you can acknowledge the patient's or the person's emotions. And I wanted to show a mark scheme as well to see what kind of things that they might be looking for. So for example, opening and setting the scene. So do they greet the friend appropriately? Do they establish rapport? Do they find an appropriate time? So ask them, is this a good time to talk to you? And then are you clear about what you're saying and are you honest? So don't lie, don't say someone else did it to preserve your friendship or preserve their emotions, or say that, oh no, I just took the cat, I gave the cat to a friend, I'll get it back for you. Don't lie just to make their emotions feel better or make the other person feel better. What they want to see is that you're truthful, and avoid blaming others. Show empathy and emotional awareness. So maybe offer them a tissue, say, do you need a moment? Problem solving and support. So this is really important and will show that you're a higher level candidate. So would you give them a solution to the issue? So would you offer practical next steps? Are you involving your friend in the decision making? Explain what you've already done. So these are the things that will really set you apart. So maybe you would take them to the vet, or maybe you would ask them, do you have a tracker on your pet? And then they go, yeah, I do have a tracker actually. So okay, let's use a tracker and find out where the pet is. So kind of problem solving with them and leading them to a decision that you're going to take together. Every single station will assess your communication style, and this is a really good way to get easy marks. So clear, plain language, be calm, supportive, open body language. So don't cross your arms, don't cross your legs, maintain eye contact as well, and give a logical structure as well. So make sure you're not throwing these points all over the place because it can get confusing for the person that owns the pet, but it can also get confusing for the interviewer as well. And it's really important in the back of your mind that you know that you are getting interviewed on these scenarios. So just make your answers easy to kind of mark for the interviewer so that you're getting all the marks possible. And then summarize your key points and reassure ongoing support. The next station is a communication station. So this is pretty similar to what was before, but question examples would be without your hands, talk through how you would tie a shoelace or describe what going to the GP would involve to a child. Make sure you clearly communicate step by step. Avoid vague instructions like cross the strings. And oftentimes they might have a prop with you. So if you're thinking of applying to dentistry, they also have a similar interview style. So you might get these kind of questions as well. So style 5 would be behavioral and situational. So this is specifically asking about you and how you reacted in a certain situation. And it's kind of similar to before about the reflection type thing. So tell me a time you worked in a team under pressure, describe a time you faced failure, how did you handle it, and give an example of when you showed leadership. So you can use the Gibbs reflective cycle for this as well. But you can also use STAR, and STAR is a really good interview technique for any position, so not just specific to medical school. So give the situation. So I played in a football team in a big match. Task, what was your responsibility? I was the goalie. Action, um, I stopped the balls going into the goal. And result, state the impact of your actions. So maybe you lost the match. What did you do? So I went and talked to my team members and I make sure that I kept the morale high and that I made sure to look at the mistakes that we made during the match so that next time we would win it. And so this kind of reflection is really good and it shows that you think a lot about what your experiences are and also how you can do it differently next time, so that you're learning throughout your experiences. So there's also a talk by Alex on healthcare and current affairs, so hot topics. You will often get questions about these as well, and it's really good that you read around these subjects. So the questions might be, what do you think are the biggest challenges facing healthcare today, or what are your thoughts on AI in medicine? So these are a bunch of examples of hot topics that they might ask about that I think are really big right now. So for example, euthanasia and assisted dying and abortion law, there are currently changes in that. Physician associates, AI in healthcare, the strikes, organ donation, and all of these kind of topics are really important that you have an understanding about those. I have put a link of a website that will explain all of these and what's going on in little bit more detail, but it can be good to keep up to date with the news as well. And some other styles that I'm not going to go into too much depth, but you can get a data interpretation station. So they could give you a graph. You need to say what's on the x-axis, what's on the y-axis, what can you see, what are the trends, what's standing out to you, and just they can ask you questions. So um, and they can link it to other different types of questions as well. So there can be multiple styles of questions in one station. Um, some universities do teamwork stations, so they can do group interviews where they make you do a task together or where they might ask you to discuss something together. And then you get academic questions. And I feel like the thing that I was scared of most personally was the weird ones. Um, like just really random ones, like how many chairs do you think there are in the world or something like that. But the thing is, these kind of questions are really rare, and I don't actually know anyone who's been asked those questions. There might be like some person out there that has been asked it, but chances are you're not really going to be asked it. And if you do, the reason why they've thrown it in is just to see how you react in um, unfamiliar situations and how you deal under pressure and how you think under pressure. So they're not asking you to give a correct answer straight away. Rather, they want to see your thought process and can you explain what you're thinking clearly? Um, or do you just go quiet on the spot and you don't really know what to say? So that's the real reason why they're asking that question. So the kind of point that I really want to get across in this presentation is when you get your question, read the question, make sure you understand it properly, but also really have a think about why are they asking me this question? What do they want to see from me? And what do they want to hear? And I think that will help you structure your answers a lot better. But yeah, thank you.
So hi everyone. Hopefully you've kind of had a bit of an introduction to interviews and what to expect from them. And I will just reiterate what we've said before. At the end, absolutely no question is a silly question. If you're thinking it, probably somebody else is. And we've all been in your position before. And it's so much better that you ask us now than you sit in your interview and think, oh, I wish I'd asked that question. So if I say anything today that you think, what on earth is she talking about? Just let me know in the questions at the end. So I'm going to go through some hot topics, hopefully. I was actually, my medical school uses student interviewers. So some of the stations are actually medical students running the station and interviewing the candidates. And I was actually the interviewer for the NHS Hot Topics question this year on my sort of medical school's round of interviews. So I'm going to kind of focus a little bit more on how to answer these questions, because I think that was the biggest difference that I saw in candidates. Was the people who gave really good answers weren't necessarily the people that knew the most about those topics or could quote me the most number of facts. I think the people that actually gave the best answers were kind of more in how they structured and processed it, and you could tell that they really cared about what they were saying. So I'm going to go a little bit through kind of how to do that, and then we'll look at some of the key topics at the end. So NHS Hot Topics questions are all kind of questions that are focused around things that affect patient experiences or affect how we deliver care in the NHS. And they can kind of be divided into three groups. So we've got questions that focus on individuals, questions that focus on systems, and then questions that focus on processes. So for questions that focus on individuals, these are kind of ones that focus on factors that individual people do and how that affects the delivery of care. So we've got a really good example down here. So equality and diversity is probably a theme that you've heard sort of around in the news and things like that. But what does it actually mean for patients? So a really great example is a lot of sort of the medical textbooks and websites that we use to learn as medical students still tend to use images of sort of health conditions on white Caucasian male models. And it kind of means that as doctors, quite often we're not very good at recognizing these diseases in other groups of patients. And what does that mean for the patient? That means that person has to stay in pain for longer. Maybe there's more of a delay before they get their treatment. And that all has an impact on that patient process. So that's a really good way to kind of take that really simple idea of equality of diversity and show why it's important to patient care. So if we then take on kind of the systems approach, these are kind of questions that focus on the way that maybe teams operate in the NHS or groups of people, or the way that the NHS is kind of structured and managed and things like that. So we could take just a surgical team. We could also take how an entire hospital runs. We could take how entire NHS trusts run, or even how sort of the NHS is structured in general. So you might be thinking about things like how the government and politics and economics even kind of come into healthcare, and how you can go from that sort of big topic like the government or decisions that the law makes and the impact that has on individual patients and the treatment they receive. And then you can kind of look at processes. So this is a bit more kind of the technical way that healthcare is delivered in the UK. And again, the impact that that has on patients. And I think this one is best described through an example. So a really great example is how a couple of years ago with kind of Brexit, and we're still seeing the same effects now, there was a big kind of hold up in the pharmaceutical industry. So it was really hard to get access to lots of important drugs for patients. And again, if we take that kind of big process, if we take sort of Boris and him sort of deciding on Brexit and things like that, and we take that right down to the patient that sat in Scunthorpe Hospital, what does that mean to them? It means they're in pain for longer. Maybe their disease can't be managed as well. Maybe they don't get access to, maybe they get access to only kind of the second rate medication that's not as good. And none of that is very nice to experience with a patient. So that's how you can really show that you've got that high level of understanding, that you can take big headlines in the news and show the interviewers what difference, why do patients care about that, why is that important to patients? So I would say the best way to kind of structure your answer to these questions is to take this really basic structure here. So we've got kind of insight, reflection, and then problem solving. So this insight is actually taking the problem itself and kind of identifying the key aspects to it, what's going on. So if they ask you a question about something, what is that thing? What are the facts about it? And then it's going through that reflective process and actually kind of acknowledging how that thing makes a difference to patients and why that thing has an impact on patients. And then you can start to look towards problem solving. So actually, what can we do about this issue? How could we change something in the NHS that would make a difference to patients? So what are these questions not? And I think this, if you take one thing away from this talk, this is probably the most important thing that I can say. And it's that these questions aren't about sort of factual recall or what facts you can tell me about that thing. So I'll kind of explain this through an example at the bottom because I think it makes a lot more difference, or it makes it easier to understand. So if you were given a question like, what do you know about the Fraser guidelines and Gillick competence? So you might have come across this a little bit in your reading so far. What you're looking to do when you answer this question is briefly kind of summarize some facts, the key headlines, just give that. That's all you need to do. And then you want to actually break it down and think, why are these guidelines in place? Why are they important for patients? What difference has it made having these guidelines in place compared to not having them in place? And why are they important to sort of protect patients? And then you can kind of look to reflect and think, could we have guidelines that are similar to this for other areas of medicine, or could we make these guidelines better? And how would that make a difference to sort of patient outcomes? So yeah, if you take one thing away from this talk, it's not about answering these questions with how many facts can you tell the interviewer, because medical schools can teach you facts and sort of give you the knowledge, but what they're looking for is that you have that higher level of kind of critical thinking and understanding and being able to put the patient first. So some kind of like top tips on how to approach these questions. I think the biggest one and the main one is don't rush your answer. The easiest way to say it, and I think Parveen definitely highlighted this earlier, is they can ask some weird questions in interviews. I think particularly with the hot topics questions, they can kind of take any concept that's maybe been in the news recently, and sometimes they can be quite abstract in the way that they're worded. They can be slightly ambiguous, and you can kind of read them and think, how on earth does this relate to the patient sat in the hospital? But when you get questions like that, just take a few seconds. So kind of leading on to my second point here is medical schools have usually selected that question for a very specific reason, and your job as the interviewee is to work out what that reason is. So just take a few seconds and don't rush into the first thing that comes in your head and then be stuck talking about that topic because you've picked it and now you've got to run with it for the rest of the interview. It can feel like it's really overwhelming to think, oh my gosh, I've got to interpret this question as if it's like a GCSE English exam. But actually, usually, if you think about it for 2 or 3 seconds, you can usually pick up on, they'll usually put quite subtle hints in the question about what they want you to talk about. And it's about taking those few seconds to pick up on those hints. And then if you're struggling with the question, or you just don't know how to answer it, or actually if you just get really good at using this structure, go back to that insight, reflection, and problem solving. So whatever they've asked you about, pick out the key facts, pick out the key reasons why that's really important to patients, reflect on why that makes a difference to patient care and why that's really important to patients, and then maybe suggest a couple of ideas that it could be improved or changed or something else could be made like it. So as I say, I've kind of given you that structure. Just keep going back to that and practicing it as many times as you can. And then also, if you're thinking about other ways that you want to kind of structure your answer or improve your answer, these are really good things that you can relate to. So depending on how and where you kind of are in your interview prep and process, you'll probably have come through or be aware of things like the NHS core values, the NHS constitution, and the NHS 6Cs. They're kind of buzzwords that a lot of the medical schools really pick up on and really like you to mention. I think some people don't like the idea of buzzwords because you're possibly just saying them because that's what they want you to say, not because you necessarily value those things. But just learn them and reflect on them and think about why they're important and why the NHS has chosen those things. They're kind of just bullet point words, so they're not too difficult to learn. I also think a really good one to use in these questions is your going back to your medical ethics and kind of referring to that. So if you're struggling to think about how does this thing impact patients, go through your medical ethics structure, because it gives you a really good structure. So you can think about how does this thing affect patients' autonomy, so their right to choose their treatment and be involved in treatment decisions. How does this thing benefit patients? What does it make better for patients? Is there any reason this thing could create harm for patients or be a bad thing for patients? And then justice is kind of like, where does it fit into their rights? Where does it fit into the law? And things like that, possibly some ethical arguments. And then I would also recommend that you have a little look at the GMC Good Medical Practice. It's something that's kind of a hot topic in itself and is just good to be aware of. It's a really long and boring document. So just focus on the highlights of it. And as with any of these sort of hot topics, when you're going through them and practicing, just focus on the real sort of headlines and highlights of those things. Don't go into crazy detail because it's not necessary. And then I would also have a look at this WHO fact sheet. It just relates to some of the sort of rights that people have to health and things like that. And it's just a good thing to comment on. And this kind of summarizes it really nicely and just gives you the headlines that you need to know. Oh, I did not mean to click on that. See if I can get back. Hopefully you can still see my slides there. Okay. So I've given you on this slide a list of kind of the main hot topics. As I've already mentioned, really just focus on the highlights. So I think I've put in this box down here, think about how each of these topics you would fit into that insight, reflection, and problem solving structure. And literally just give yourself, maybe fold up an A4 piece of paper and use half a side of paper for each of these topics. You don't need to go into any more detail with your prep for that. And it's just my kind of advice and guidance is go to a level that you can just about sort of feel familiar. If I asked you to talk about organ donation, you could give me a couple of arguments for and against. And as long as you can explain those and have an understanding of those, that's more than enough information. There's also a couple of other things to be aware of. So I would have a very sort of brief understanding of how the NHS is structured, what different groups of people work in the NHS, what do they do, why is it important that they're all there? And there's also a couple of case studies that, again, just focus on no more than a couple of sentences, just so that you're aware of what those things are if anyone was to bring them up. I think it's very uncommon that they would specifically quote a case, but it could come up, it could be possible. So just know something about it and just kind of keep aware of the headlines and the news and things like that. And yeah, the practicing structure is just getting really familiar with being uncomfortable. You can practice by yourself, you can practice with friends, you can practice with family. You don't need to necessarily do it in a formal environment, but you can also practice doing things to time. But just get really comfortable with picking up a completely random topic and talking about it. Decide, take a random headline in the news and think, do I agree with this thing? Do I not agree with this? Why do I agree with it? Why do I not agree with it? And just the more things that you can expose yourself to and the more times you can practice using that structure, the better you'll get at answering these questions. And then I've given you sort of a couple of questions to have a practice at by yourself. Again, you can write out answers to these, you can give them to other people and get them to ask you. What you can also do is make your own questions. So use these. I've kind of tried to pick different structured questions, but just slot different words in from that other list that I've given you, and that will give you a whole bank of practice questions. And down here, I've also tried to highlight where those different sort of parts of the structure come in to how you would answer this question.